So on FAME short-term trips, we like to invite both medical professionals as well as non-medical professionals to work at our medical outreaches. We also do health education and zero in on preventative health care measures so that we can decrease the amount of medications that locals could become in need of. We know that sometimes lack of resources on their part makes it almost impossible for them to get the medical help that they need. So we hit everything from a preventative side.
So hey friends, so here we are at the start of the FAME clinic in Kalemu. So as a patient presents to the clinic, they start here at the registration table and then proceed over to triage. And the really cool thing about the triage station today is it's mainly run by locals. So these are our friends that have been through previous medical trainings and are taking the patient's vital signs and assessing their chief complaint of presenting to the clinic, and then they'll proceed through the clinic from here.
This is our provider station. Our providers determine what the illness is of the patient that they're treating. They not only diagnose but also determine what course of treatment is best to serve the patient's physical needs.
So this is the pharmacy station. It starts when the patient brings their triage sheet to us. And on that triage sheet, it says their name, their diagnosis, and everything, as well as the medicines they want. The provider wanted to give the patient. We carry an assortment of medicines, most of them over-the-counter and most of them pain medicines, multivitamins, things like that. We also carry a select few antibiotics and anti-diabetics as well as antihypertensives. We carry no narcotic pain medication just because of legal concerns when traveling. We don't want to bring that in. We can't really take it out of the United States safely. So when the patient comes in, we work really closely with the translator to instruct the patient to take their medications carefully and any information that they might need. We use labels that show in the morning when the sun comes up, in the afternoon and the evening, so the language barrier isn't as much of an issue when we're trying to know what medicine we're dispensing and communicate that to the patient. So it's all really about working closely with the translator to communicate safe medication practices for these patients and to reinforce any lifestyle modification the provider has recommended to the patient.
I work in physical therapy, and when I first thought of going on a trip as a physical therapist for FAME, I really didn't know if I'd have a part in it, because what am I going to do without my equipment? What am I going to do? And what I realized is people here need a lot of education on body mechanics. They work very, very hard in these countries, and they need to learn different techniques, how to protect their joints and how to protect their back, how to lift things, carry. I find they have a lot of neck pain, a lot of joint pain, and a lot of back pain. They don't know what they can utilize in their community to help their pain. Of course, we don't have canes available and walkers as we do back home, but they can use walking sticks and learn how to utilize things from their community to make their work easier. There's a lot of feedback that we are helping them. So I feel greatly utilized on this trip, to my amazement, because I really didn't think that I could do this without all my bells and whistles. But it is very possible, and I'm very pleased to do this, and it's been a blessing to me, and I hope a blessing to my patients.
Hi, we are here again, this area. So we are not only treating the physical needs. So before we do the medical things, we started with the evangelism people, with Harvey here doing his magics. We call it the gospel magics. So sharing the message through the magics. Also we are treating people with the physical needs. So this is, we call it like, we're not only doing the physicals, also doing the spiritually also. It's like the holistic ministry.
Though they are doing medicines, I am here as a team member to be able to present the message of Christ in my unique way of magic and the activities that I do in order to be able to present God in a different light for these people.
Today we're at a medical outreach, which we are providing medical care with the hope that evangelists in this area can do follow-ups that might allow them to share Jesus Christ with the same patients that have come here today and use that to their advantage to reach more people for Jesus.